Hey there, I'm going to be talking about my policy and how it relates to the issue that I'm talking about, which is health disparities and discrimination in San Francisco against LGBTQ elders. Um, so the problem that I was looking at, let me pull it up real quick. So the problem that I was looking at is basically the issues that LGBTQ elders face, specifically in San Francisco, but of course it's happening across the nation. But in San Francisco, it's being brought to the forefront right now because of San Francisco's history of accepting LGBTQ people and having a thriving LGBTQ community. So I did the 5 Whys worksheet for this problem, and the problem that I named was LGBTQ elders having high physical and mental health needs compared to their straight peers. Um, and when I looked at it, the first why is that there's lack of access to mental and physical health care. The second why was that for LGBTQ elders, there's often a fear of discrimination or a history of abuse by providers and specifically the government. And specifically as people age, there's, they are also informed by their past experiences. And while things in society might be changing, a lot of LGBTQ elders are already conditioned by what they've experienced growing up, by their families, by the government, by wherever whatever services they've tried to access in the past. So the third why was that there are historical attitudes and practices that reinforced homophobia and transphobia in medical and mental health care settings, including the DSM, et cetera. And then the fourth why is that LGBTQ identities were pathologized and deviant in medical journals and in the DSM. And the fifth why, to go back to why those attitudes exist in the first place, is really puritanical cultural and religious norms in the United States that have been here since colonization. And of course, that's a really huge one that has a lot of whys to it that I can't completely get into. Okay, so the policy that I'm specifically talking about, so there was the LGBTQ aging task force that was started in the early 2010s. So I believe it started in 2012. And it was a bunch of different providers in San Francisco came together to address this issue of LGBTQ elders not being able to really stay connected where they were, having issues going into nursing care facilities and other care facilities, as well as experiencing like some people having to go back into the closet when they went back into nursing facilities, being discriminated against by home healthcare workers, by different programs or things that they were part of. And also housing in San Francisco is a big issue. And so people also not having housing. People, of course, the aging issue is a really big deal for LGBTQ people who don't have children or other family, people who are disconnected from their family of origin because of homophobia and transphobia. So one of the policies specifically that was created out of this task force was I think it's like the Elders Bill of Rights, the Seniors Long-Term Care Bill of Rights. And so essentially it strengthens protections for LGBTQ seniors who live in long-term care facilities, and it protects them against discrimination, such as misgendering or misusing the wrong pronouns for a transgender or non-binary person. Other types of discrimination include denying admission to a long-term care facility because of their identity, transferring people out of a facility or into a different part of the facility because of anti-LGBT attitudes of other residents, like making them the problem rather than the transphobia or homophobia of other residents, and including other types of discrimination like eviction or involuntary discharge of a resident based on people's perceived sexual orientation, gender identity, gender expression, or HIV status. So this now exists in order to protect people who live in long-term healthcare facilities. Of course, not all LGBTQ people or adults or elders live in long-term healthcare facilities or nursing homes, but it does protect those who do. So additionally, another policy was created that I don't know the exact name of it, but basically it allocated funding. And so this policies task force, the task force was basically created in order to identify all the different issues that existed in San Francisco and then to create suggestions for remedying those issues within San Francisco. And as of right now, I actually recently went to a celebration of the task force of what is it? 8 years, nine. I can't do math, but it's been a significant amount of time since they started it, and they've actually implemented every suggestion except for two. And the different successes that they've had is creating different care navigation programs, like the one I'm interning in, creating different programming that helps with housing monthly stipends to help with rent, help with rapid rehousing, or to help avoid eviction. Um, they've had different like financial workshops and a bunch of different programming in the city. They've also opened up an LGBTQ specific affordable housing unit that is near Church and Market called Open House. So the history of the problem, or the so actually I'll talk about demographic data. So part of what what I was looking into for my policy paper or for my social problem paper is just basically how there's huge health disparities amongst LGBTQ people compared to their straight counterparts. There's, significantly higher mental health issues, physical health issues, lack of support from family, community. Um, it it really is clear that there's a huge disadvantage or huge um, what's the word I'm looking for? Disparity for LGBTQ people. Um, so, and additionally, on top of being LGBTQ, it's also that people are aging. And right now, the United States is having like a huge boom where right now, I believe about 13% of the population is 65 or older. And then by 2030, it's going to be about 20% of the population. So it's really grown and it's putting a huge strain on our system that wasn't actually built for a population of that size. And then specifically, it's not really able to meet the needs of the diversity of these aging people. So including people who speak different languages, who have different religious or cultural backgrounds, who have different experiences or histories within the United States of being marginalized, specifically LGBTQ people. So let's see, the history of the policy, I just explained that. And then the underlying values of the policy. Specifically with the long-term healthcare Bill of Rights. So the real underlying values there are basically that all aging people deserve to age quote unquote successfully or with dignity. And unfortunately, that hasn't been possible for many LGBTQ people. So the goal is really to offer them the same expectation that all people who are aging should expect, is that they can continue living their lives and identifying as they identified prior to being put into a long-term healthcare facility. And then I think part of this task force in creating this additional fund allocation for other programming is that understanding that San Francisco is or has historically been a safe haven for LGBTQ people, and wanting to keep it that way and to move away from the LGBTQ community being so youth centric and focus on young people, and being able to understand themselves and ourselves as being older. Because I think also additionally with the HIV/AIDS epidemic, there was kind of this lack of being able to conceptualize LGBTQ people, specifically gay men, as older, and also additionally for trans women or other trans people who have higher mortality rates at young, especially people who are dying at younger ages because of transphobia and transphobic violence. It's hard to imagine yourself being older. And so without the same family support systems that straight people might have, or people who have had children or have extended families, and who have had historically the ability to marry, it was not something that people had really thought about. So now as the first generation of people really aging and us having to deal with how to support them. So um, the different forces that are affecting this policy. So of course, like nursing homes and different like in-home health in different places are going to have to train their staff. That was one of the mandates of the policy of the task force, was to get staff trained and culturally competent. Um, and politically, there's been a lot of backing at the celebration of the task force that I just went to, like Mayor London Breed and a bunch of different, a senator and some of our different city supervisors were all there. Like, it's definitely something that politically in San Francisco people are attending to. And the social forces, I think part of the reason why this had to be championed by, at the time, a city council person, city supervisor rather, was because socially there wasn't as much push specifically from within the LGBTQ community for the reasons that I mentioned before. So let's see, the advocacy efforts and the coalition building that I have seen, I think, is really amongst different agencies that work with aging people to get them to understand the needs of LGBTQ people. There's definitely a network of people, of different agencies who work with LGBTQ elders and with elders in general. Specifically, a bunch of different organizations within the Tenderloin, within the Castro, within, I think, also within the Mission and other areas, to help kind of address this need and the fact that there has been a lack of addressing this need in the past. And as far as unintended or unforeseen consequences of the policy, I can't say that I know of any. It seems like it's actually been very successful in a relatively short amount of time. I think the biggest thing I've seen, at least in the program I work for, is I feel that gay men, cisgender men, and specifically white men who may have had access to social programming during the HIV/AIDS epidemic seem much more likely to access services than low-income people, than non-white people, people of color. Then I think transgender people and cis women are also less likely, it seems right now, to access services because I think there's a lack of trust of city agencies and of some services, especially if they've had bad experiences. And I think the gay male population has more experience accessing nonprofits and accessing government agencies, especially because of the AIDS epidemic, and learning how to get support from agencies like that. And if other groups haven't had that same access or experience, I think it's harder to conceptualize asking for that help. And in terms of the development of the policy and evaluation, I think the policy is great. I think more needs to be done specifically around housing. I work with clients who make far below the poverty level, and there's no housing that's affordable for them, and they're stuck in really unhealthy, really dangerous situations, especially as they age. And it makes me very worried about their health and well-being. And people who have really severe, because of the health disparities, have very severe physical and mental health needs, and then on top of that are living in really marginal housing and potentially at risk of being homeless. And there is no good shelter or anything like that for older LGBTQ people. So I've heard really negative experiences actually by some older LGBTQ people who've had to access shelters in the city, and they experience homophobia and transphobia in those spaces. So I think housing is something that's huge. And while there's been a big push of the affordable housing, even the affordable housing that was created recently, I think the newest building had 40 units, but I think even the lowest income or the lowest rent was $1,100. And I have clients who could pay half that, barely. So I think that's definitely the next issue, the next thing that I hope they tackle more directly. Thank you.